I think for some people food is an addiction. The addiction centres in your brain sit very, very close to your appetite centres. And so there is a real crossover between addiction and this disease state.
We look at our skin and our skin is covered in bacteria, but exactly the reason why they go from living happily and harmoniously on our skin to causing problems in the wound is something that we're really only just beginning to understand.
But the brain is really profoundly an electrical organ. Everything that happens millisecond by millisecond in the brain occurs because of the electrical firing of nerve cells.
Overseas, they're definitely seeing increasing numbers of superbugs than we are in Australia, as well as the superbugs are more extreme.
In agriculture, we use antifungal sprays on our crops, and these are very similar to the antifungal drugs that we would use in a hospital to treat a patient with a fungal infection.
The exploitation of others is done by people who are very able to cut themselves off and deny the moral wrongness of it.
So some of the evidence that we find is often almost a decade or longer from when somebody starts developing problems with alcohol and drugs or gambling before they seek help, and that's an awful long time.
I think there are probably many pathways of why individuals come to addiction. Often a lot of those things that we do in the environment or that affect us, they tend to change one of a few systems that we have in terms of our psychology and our brain.
Some of their eating behavior is driven by strong cravings for certain types of food and by some problems to control the intake of that food.
Using these sorts of technologies, artificial intelligence, the smart technologies, really is going to offer the opportunity to test out ways to deliver support that's more cost effective